Okay, hello everybody. And the online people can hear me? Okay, thank you. Thank you all to be there in this symposium that is about the computerized assessment of the executive function. In particular, we will present two different tools recently standardized for the Italian population. In the first contribution, the Dr. Costanza Ruffini will present a systematic review about teleassessment, because recently teleassessment has been the use of teleassessment has been increased a lot, but there is still a lot to do to understand how teleassessment can help clinicians and children, and how tests can be transported from pencil and paper to teleassessment. And then there will be a video contribution, because one colleague, Agnese Capodieci, due to a health issue, can't be there, but she sent us a video presentation about Telefe, that is a new tools for the assessment of executive function that can be used in person or via remotely. And then I will talk about MOXO, that is another tool to evaluate attentional processes, that is a computerized test that has been standardized in many countries, and recently me and my group standardized for the Italian population. I'm Carlotta Rivella from the University of Genoa, and I'm a PhD and in psychology, and with Costanza Ruffini and Agnese Capodieci, that are the other presenters, work about the standardization of new tool for the assessment, in particular executive function. And in our opinion, teleassessment of executive function is a particular difficult topic, because executive function concerns self-regulation, attention, and it's not easy to understand what we are measuring when we are that, for example, the children in front of us with a paper and pencil test, and in a room with only one clinician and the children, or when we assess the children at home, where there can be distractors or other conditions that influence the performance. So in our opinion, it's very important to understand how the teleassessment can be improved for executive function. So now I will give the talk to Costanza Ruffini.
Okay, thank you, Carlotta. Can you hear me?
Okay.
Let me know if you can see everything, both remotely and in presence, because I think, okay, right now I will leave you. Okay. Everything's fine.
Okay, perfect. We can start.
Perfect. Thank you, Carlotta, and thank you, everybody, for being here. I'm Costanza Ruffini, psychologist and PhD students at my third year in psychology at the University of Florence. My slides goes on their own. Okay, so today I will present to you one of the work which characterize my PhD, which is the teleassessment of cognitive functions in developmental age, a systematic review. A work which started in 2020 due to COVID, or linked to COVID-19, as everybody needed, both in terms of clinicians, clinical setting, but also university setting, so academia, we need tools which could be used remotely, as of course we couldn't stay together with students, children. So we started from a definition of teleassessment, especially cognitive teleassessment, which is a type of assessment of cognitive function in which examiners and participants are not in the same place, in the same setting. They are connected each other through technologies, for example, through computers, tablet, using web platforms such as Skype, Google Meet, and so on. We know that, of course, teleassessment has some strengths, but also some weakness. Among the strengths, we can find the fact that thanks to the teleassessment, there is a reduction in travel time and costs, especially in America, where to go to clinical settings, for example, to have an assessment path, we have to walk and drive a lot, also days. So especially in America, the use of teleassessment has spread a lot during the last years, and it reduces travel time and cost, of course. Then in teleassessment, increase the accessibility to an assessment pathway, and at the same time, it reduces the waiting list, of course, because it gives to many people the possibility to receive an assessment. At the same time, it helps to have the access to an assessment pathway, even in emergency conditions such as COVID-19, during the emergency of COVID-19. For what concerns the weakness of teleassessment, it is clear that it is a very recent and not yet well-defined procedure, especially in developmental age, because we know how difficult it is to do an assessment with children. Think about doing it remotely. Especially another big problem is the absence of standardized tools for teleassessment. So what we use usually in a remote condition is to use classical standardized tools for paper and pencil use in a remote condition. And then it is also important to consider that in a remote condition, in a remote setting, it is not possible to check, to control for child behavior. And it is not so easy to establish a nice relationship with the children, because you are not together with him or her, of course. So, considering that there is an increased need for cognitive teleassessment following COVID-19, we thought to do this, to study and to perform this systematic review. So we had as first aim of this study to describe the cognitive functions most frequently measured by cognitive teleassessment in children. And we would like also to underline, to deep, the variability in terms of procedures used and sample characteristics involved. Secondly, we would like to investigate the validity and reliability of cognitive teleassessment in children in comparison to the in-person assessment. So we use the classical Prisma statement for the systematic review, and we mainly define three topics. All the terms concerning children, all the terms concerning teleassessment, and then the last group relates to cognition, so all the cognitive function that we can think about. As inclusion criteria, the paper we selected had to use teleassessment, so a modality of assessment in which the experimenter was not present, was not in the same room of the child. Then the teleassessment has to measure at least, has to include at least one cognitive measure. We included only primary research articles, so empirical studies, and papers written in English language. Then, of course, we made a criteria of population because we involved only children, so from 18 months until 18 years. This is our Prisma. We started from 745 studies, thanks to searching in PsycInfo, Scopus, and PubMed. And according to inclusion and exclusion criteria, both in the title and abstract phase and in the full text phase, we included 23 studies. Firstly, we ran a quality assessment of the study included. Especially, we use the KMET scale, which divide and according to which we can divide the study in high quality, medium quality, and low quality, mostly according to measurement criteria, so all linked to the method used by the studies, but also to the results obtained. So the majority of the study included had a high or a medium quality. Then, according to the first objective, what we can say about the first objective of this study? The population involved in the study were both typical children, typical developing children, but also atypical developing children. So there were, for example, studies conducted in schools, so mostly addressing typical developing children, but also clinical settings. And what about the settings? We, in fact, can say that mostly this type of studies were conducted in clinical centers, hospital, but also some studies involved children at home or at school. For what concerned the cognitive functions most investigated were language skills, then academic skills, but also neuropsychological functions such as intelligence, such as memory, executive functions. However, mostly the majority of the studies investigate language skills. And this is interesting because another result linked to this systematic review is that the most common results that the most common difficulties that these studies found were linked to language skills, because in language assessment there are a lot of things that could happen, for example, freezing of the screen, audio lagging. So the language skills are the most assessed, but also the most difficulty assessed. Then another interesting result is that in every study except for two, there was an adult next to the child who, of course, did not intervene during the assessment. However, he was a fundamental presence because he or she helped the children when there could be some problems, some technical problems, or anyway for safety. Then what about study design? We included 9 studies within a subject design, 2 studies within subject design, 2 studies mixed subjects, and interestingly, 10 studies conducting a single assessment, which was simultaneously scored in presence and remotely. Another result linked to the first research aim is the time. We found that cognitive teleassessment requires more time than in-person assessment, which means that you have to consider a longer period to conduct an assessment remotely. Why? Not for the assessment itself, but for the preparation of the setting. So for the computer, web conference, and so on. According to results of the second objective, we found that all the studies found a high level of satisfaction and received positive feedback from parents, children, and general staff involved in cognitive teleassessment. So this result let us understand that, okay, cognitive teleassessment is a feasible type of assessment. At the same time, as a negative aspect, many studies underline that there were technical problems during the assessment, such as problems in the room setup, connectivity, audio and video quality. However, these type of problems did not affect the assessment, even if these problems, of course, caused a longer time needed to conduct the assessment in comparison to in-person one. Then, lastly, our systematic review found that there was a high level of agreement between cognitive teleassessment and in-person assessment in all studies, although these varied depending on the function investigated and the test used. As I previously said, the language skills were the most difficultly assessed. So what we can say? Sure, we can say that cognitive teleassessment was found to be a feasible and valid procedure for the assessment of cognitive development. This is a result. However, a good cognitive teleassessment procedure requires good practitioner training. So the examiner who used a cognitive teleassessment modality, a cognitive teleassessment tool, need to be carefully prepared. And the message that we would like to share is that cognitive teleassessment should be regarded as supplementary to and not a substitute for in-person assessment. So for the limitation, of course, this review has some limitations. And what about future directions? As the big limitation of this review, we have that the studies we included were so different each other because they involved different population, they used different tests, they assessed different type of functions, and also the study design and statistical method used were so different. Moreover, concordance data were analyzed in qualitative terms only. We couldn't use a meta-analytic approach due to the differences between the studies included. According to future direction, what we can say? There is a need for new studies on cognitive teleassessment in comparison to in-person assessment. This is clear because we have very few studies, and this systematic review underlined this aspect because we didn't put any time limit, so we only found 23 studies in the history, general history. There is also a need for standardized procedure to reduce technical problems. This is a clear result of this systematic review. And then there is a need for tools with normative data, collected, of course, and defined remotely. What we define also were good practice. We define a kind of guidelines for examiners, for clinicians who would like to use a teleassessment procedures of cognitive functions in children. So these are the general aim of our guidelines, the general topic. Firstly, we would like to underline the importance to set up the room properly. So to know how to prepare the room, to what put attention, and to and all the elements that shouldn't be present during the assessment in a remote condition. The room, of course, of the clinicians, but also and especially the room where is the child, which could be at home or at school, for example. Then it is important to ensure that adequate technological devices are available And child needs to familiarize with the examiners and the equipment. So it is important to not start soon with the assessment, but to create a familiarized setting, a familiarized climate. Then it's important to engage the family also before the assessment. So, for example, with a brief call to present what we will do in our teleassessment condition and how to prepare the setting in their home, for example. Then it is important to pay attention to psychometric properties and protocols. This is so important because we used to use remotely the rules and the tools that we use in present. It is not so equiparable to use the same, for example, test in a paper version and to put it on screen. Then, lastly, but not for importance, a remote examiner should consider legal and ethical issue. For example, if he would like to record the assessment to check, for example, after the end of the assessment something, it is important that he or she has in the informed consent, for example, this aspect, which is different from the in-person assessment, of course. Here you can find the download if you are interested to our manuscript, which is published since 2021 in child neuropsychology, and you can download free. So if you are interested, of course, you can check for it. I thank you, everybody, and I'm here for any questions, and yeah, thank you for listening.
Thank you, Costanza. There is some question, consideration.
Maybe I'll give some thoughts. It's okay.
Okay.
I'm trying to give some discussion. I agree that I would go to the end, but there's so many things said that I would like to say now. First of all, Constanza, thank you. Very interesting review, if you hear me. I learned a lot.
Perfectly.
And, I had some ideas. Yeah, that's really because I learned a lot. Why do I say that? Because tele-assessment, tomorrow I will talk about digital testing. Tele-assessment is rather new, and it's a very difficult thing. So for me, number one, what I had as reflection is indeed there is a need for it. And there are a lot of children, they call it waiting rows in Belgium. There's no time to give a child assessment. So this is a tool. That's kind of gift of COVID, and that we can work with screens. Of course, tomorrow I also say it's the new world, rather new, but I will give examples of 1960 about really the first studies about working with screens. It's crazy long time ago. So it's long, but the tele-assessment is one kind of assessment. That's the child is at home or somewhere and I'm here. This gives opportunity, but it's a new world and it's a brave new world. No, I'm a skeptical new world. Skeptical new world. I want to say that, and you did it very well, Constanza, showing strength and weaknesses. And there's a lot of weaknesses, and you just show them. You put them good. And I also heard, for example, the major thing is what are we measuring? Are we sure what we are measuring? And another methodology is standardization. What is happening at the other side? Do we know the child is interacting? The child is not looking away, looking at it, cell phone. So a lot about conditions, but you named a lot of these dangers. So I think it's very, very interesting. What I also like very much is that digital is seen as a supplement. Digital is not going to be the new world. It's gonna always, if I go back to my risk, I always say we're gonna need the paper and pencil test, and the computer is something supplement. And they give different information, but they are supplementary. I'm sure I will not be here in 30, 40 years. It will not all be digital. some things you need to do face to face, and you need to do with your hands, and you have to look, and you have to smell somebody to know what's going on. So as a supplement, I like it, and I keep liking it. At the end, you say the guidelines, the good practices. What can you do to prevent bias? Because there's a lot of bias when something is, if I'm just here, that's reasonable, but at a distance, even your voice, the technical problems you talked about. So good guidelines, good practices, that's all what struck me. Sorry, Constanza, it was a lot, but it was positive. Somebody else has something to say before we listen. There's the need. For me, there's weaknesses. Be careful. For me, I'm a skeptical one, but not for studies like this. Or your study, I know you do it digital and you have data digital. That's no problem. I'm very skeptical with publishers who just do things paper and pencil, and afterwards they sell computers and do the same test on a screen. And then I say, as a scientist, if you do the same test on a screen and I do it next to you, that's a different world. I can show you maybe just one example. We did a lot of tests, but just looking at the screen, parents looking at the screen, or parents looking at the paper, the answers are very, very difficult. You are asked, how is your daughter? My daughter is okay. Does she does that? Does she does that? That's on paper. And here you have a screen, same questions, a different world. So just the screen creates something new that we don't get so far. But there are a lot of examples. That's what we call equivalency, equivalence. How is paper and pencil versus a screen? I keep on talking. Did I have also? Come on, somebody, a reaction, and then we go to paper 2. Yeah?
I have an experience in administering verbal test for adults, not children.
Mm-hmm.
And we compare usual norms, standard norms for the same test. Mm-hmm. It's a simple verbal memory test.
Yeah.
And we found more or less no difference between paper and neuropsychology. Yeah. But for this verbal test, some difference we think that comes from different norms, such as 2022 and 2000, 20 years older. But no difference for this kind of test.
Yeah.
Other tests with different modalities, the difference could emerge.
Yeah, correct. That tomorrow I will also say that the equivalence studies show it's depending on what you're measuring, but there's also but be aware there's nearly always differences, but the differences are small or big depending on what you're measuring. And I'm pretty sure we are not sure what's happening here when we had the screen. But one example, if you can scroll or don't scroll, if I can see the end of the test or not, that makes a difference. Can you imagine that? If you can go back or don't go back, makes a difference. This is a new world. So for me, it's the new world, and it's a nice review and a lot of studies I don't know. And remember also, tele-assessment is only one digital way. Tomorrow I will tell you there are 5 big different kind of digital ways. Okay, I'm gonna stop.
Okay.
Paper 3 is a video, I think. No?
Yeah. No.
Thank you a lot for your intervention. I remain here for any other questions.
Yeah, with pleasure.
Now I will start the video of by Agnese Capogliesi. That is the second contribution. That is about teleassessment of executive function and the comparison between typically developing children and children with specific learning disorders. As the video is a little bit long, maybe I will try to cut in some point to stay in the
You're just
in time.
looking for how much,
It's okay, but
when it's finished here?
Yeah.
When is it finished?
5:30.
Right.
Okay.
You also have to talk, so
Yeah.
see that you have
So-
some time.
So if you don't understand something or you have cut in a point incorrect, you can tell me. And also about the questions, you can ask, because me and Costanza Rufino also collaborate with Agnese, so we can try to answer to your question. Okay, let's start. Okay.
Perfect, thank you.
To thank Dr. Rivella for the invitation and the opportunity to share our research. In the last slide, you will find my email, and so I'm available for any questions or curiosity. Today, I will talk you about the tele-assessment of executive function in children with specific learning disorders. Probably Dr. Ruffini have already talked to you about the executive function component, but I think it's useful to make a brief reference to the executive functions construct that will be then evaluated and discussed. So the inhibitory control component, and that is the ability to suppress automatic or prepotent responses that are not appropriated in the context, and to control interference or distracting stimuli. Updating, that is the ability to manipulate and update information in memory according to the task. And shifting, that is the ability to consider multiple perspectives and generate alternative solutions or switch between different problem-solving strategies. As we know from literature, in cases of atypical learning development, such as the specific learning disorder, SLD, the presence of alteration in executive function is typical. The neuropsychological profile vary from individual to individual, but we can consider that as a group, normally we found a mild impairment that is in domain general cognitive processes such as automatization and executive control, which are fundamental mechanisms for learning. It should also be noted that executive function can contribute to the activation and use of compensatory strategies and modulate the impact of SLD on adaptive functioning and probably even on the evolution of the disorder over time. From literature, we know that one of the most frequently impaired executive function in SLD is working memory, both in the verbal and the visuospatial modalities. But even response inhibition and interference control have been documented as impaired in SLD population. Considering the dual process model, the performance in response inhibition and interference control depend on two basic steps: the target selection and the maintenance of response selection on the target. Thus, impaired performance in response inhibition and interference control could be affected by a general slowness and reduced automaticity in processing the target stimulus. Impaired and shifting abilities have been also documented in SLD, albeit less investigated than the other components. Considering our study, we think about the impurity of the executive function tasks and the presence within the same task of different aspects related to the executive function process and even sub-process, like stimuli processing and processing speed. So, the interpretation of executive function impairments due to these characteristics of executive function task is not straightforward. The aim of our study are two. The first was to describe the global profile of executive function alteration in children with SLD and verify whether certain executive function components play a major discriminating role with respect to differences between children with and without SLD. The second aim was to define the relationship between alteration in sub-processes measures and executive function measures for each executive function component through correlation and mediation analysis. So, given the aims of our study, a teleassessment platform was used. The choice of this tool, the teleassessment platform, is based on literature because we know that assessing executive function in school-age children at isolation with an in-person or with a remote procedures does not lead to differences in terms of outcomes. Furthermore, computerized testing provides more accurate and valid measures of executive function processes and sub-processes, such as stimuli processing and processing speed. Finally, the computerized testing reduced the floor and the ceiling effects and allowed the comparison of different modalities of stimuli presentation and record a better response accuracy and speed. So, about our platform is a teleassessment of executive function platform called TeleFe. Inside, there is different tasks, so it's possible to have a multidimensional assessment of executive function. There are some basic tasks, complex tasks, and questionnaire. The assessment could be done online, in person, or remote, and there is automatic report elaboration. So, the process tasks are the flanker test, the go-no-go test, and end-back test. There is an complex activities that require planning task of everyday activities and behavioral questionnaire for school and family. So we have even the point of view of school and parents. As I said, there are two modes, in person or remote. There are the two dashboards, the one of child and the one of experimenter, that are synchronized so that the clinician and the child can work directly on their own tablet or computer. The clinician dashboard allows the initiation of tests and subtests and the consultation of results. The children's dashboard allows, of course, the execution of tests after the clinician have allowed that. So let's go and see the specific task.
I will ask you, how much are you familiar with this kind of task? Flanker and back and go. Nothing, so I can leave Agnese talk. Okay.
That we used for our study. The flanker test, that is an interference control and cognitive flexibility task. The end-back for working memory, and the go-no-go task for response inhibition. In the flanker task, we measure the interference control and the cognitive flexibility. The child must indicate the direction of the central target arrow while ignoring the others. So, child have this line of arrows in front of him and have to look at the central one and use the L button if the central arrow go on the right, and the S button if the arrow go to the left. In the congruent condition, all the arrows go in the same direction. In the incongruent condition, the central go in a different direction of the other arrows. So there is a first block where the child have to look at the central target, the second block in which the child have to look at the peripheral target, and the third block where child respond according to the central target if the arrows are blue, as in the first block, and according to a peripheral target if the arrows are orange, like in the second block. So, for the first and second block, we measure the interference control ability. And for the third block, we look at the cognitive flexibility. Sorry. In the flanker task, we have different indices. So the correct responses in the incongruent condition of the block 1 and 2, the response time in the incongruent condition in block 1 and 2. And this is measures of interference control. Correct responses in the incongruent condition in block 3 and response times in the incongruent condition in block 3 for the cognitive flexibility. The go-no-go task. In this case, we measure the response inhibition. So the child's ability to suppress the automatic behavior. There is a series of geometric shapes, triangles or circles, yellow or blue, and are presented, and the child is asked to respond to a target stimulus and not respond to the non-target stimulus. In the first block, the target stimulus is the yellow figure. In the second block, the blue figures. In the third block, regardless of the color, the child have to press the button when there is a circle. In the third block, when child see a triangles. So have to suppress the response that used in the block before. In this case, the main indices are the correct on the no-go, so a measure of response inhibition, and the response time on the go, so a measure of processing speed. For the and-back task, this is a measure of working memory, and the child see a sequence of stimuli in the center of the screen and must press the space bar when the stimulus match the one immediately before, in the case of one back task, or the one preceding it even earlier in the two back task. In this case, two back task, there is the blue as the one before, so press. There are 6 blocks because there are the first and the second blocks where the...
Sorry to disturb, but I see it's 17 or 2.
Yeah, I was thinking about...
It's important, I maybe
Yeah.
just listen to the last minutes. I
Yeah.
would love to hear you.
Okay,
You're
okay.
here,
I would like
correct,
to,
and
yeah,
5 minutes before half,
we can
other
stop.
people have to speak here, so
Yeah.
we have no room.
Maybe I can rapidly summarize.
Just
because-
try to summarize
yeah.
or just
It's perfect. because-
final slide, and then it's your turn.
Yeah,
Yeah?
it's perfect because that was the last test that Agnese was describing, and it was the last test in our platform because that we standardized. Because as we said before, there are no standardized tests for the teleassessment of executive function, and in our opinion, it was important to do this because as we said, for example, language is easy to assess also in distance remotely, but other cognitive function are not so easily. And so we standardized this test that have these 3 measures of executive function, and that was the focus of this talk, to present the platform. And how you see in the presentation, we also include in the platform some questionnaires for family and for school. And it was related to what Costanza said before, because we think that the teleassessment is not enough to understand a children or a person, but it's important to see he or she, and if it's not possible, have some information by family or school that know the children. So we also include the questionnaire and standardized questionnaires. And the work Agnese was talking about was conducted. Sorry, I go to the end. Was conducting because teleassessment is also very helpful for research because allow us to have multiple measures. For example, we had the measure of correct responses, we had the measures of time, and we also can measure sub-processes. For example, processing speed and stimuli processing that via paper and pencil task we can't measure. So we conducted these studies thanks to the strengths of the teleassessment and telefe, comparing typically developing children and children with specific learning disorders. And what emerges is, I only put the images to explain.
The correlation.
Okay. I see only we do the same analysis for all the tasks, but to simplify, also because Agnese know better than me this complex analysis. But we what we found is that the sub-processes, so processing speed and accuracy in basic processes, for example, in the go-no-go task, the accuracy in the go stimulus, where the child had to press the bar when the target stimulus appear in the screen, mediate the relationship between the group, specific learning disorders and typically developing children, and the inhibitory control. So there is a difference between typically developing children and specific learning and children with specific learning disorders in inhibition, the ability to not press when in the screen there is no target stimulus, but this difference is mediated by the accuracy in the go in the go stimulus. So there is also a difference in the more basic processes that explain the difference between the two groups in the more complex processes, such as inhibition. And a similar relationship we found also for working memory and for cognitive flexibility. And is also an example of how teleassessment, computerized assessment can help also in understanding the processes underlying some difficulties. Okay, sorry for the very I don't know if Costanza, you had something to add?
No, everything's fine, Carlotta. Yeah.
Okay.
I hope everybody followed this interesting study with which
I only put for a moment the contact of Agnese, so
components
if you want
your attention, and if you need,
can contact in this email. Okay.
I have one practical question. Is this just an academic platform, or is it?
No, it's commercialized by Anastasis, that is a social corporation, here in Italy that provide to school and clinician
And that's
a lot of platform for
from the beginning of your research, you work together with
to develop the platform and then to collect the data for the standardization. Yes.
Get better. Someone can use it and buy it.
Yeah, absolutely. It's
just to know whether it's pure academic or no, it's the bridge to reality.
Yeah, absolutely. Yeah. It is a platform available for clinician, and as Agnese showed, there are automatic reports that can help. But how we say before, it's important to know that also when we use computerized tools that provide automatic report and are easy to use, it's important to be prepared and to study, because there is maybe sometimes we think that these tools are easy, so we let to use students or other people with these tools, or the report is automatic, so we had not to read the manual, for example, but it's not so easy. Also, when in the report there is a lot of indices, it's important to know what every indices are measuring. So the last contribution, I will talk about another tool for the assessment of attentional processes, that is MOXO DCPT. Also, this tool is available for clinician in Italy. And then also devo prima condividere.
And just to watch the time, it's a little bit strange. The computer says 7:10 past 5, but it's not 5. My clock is like that one. Yeah. So
at 10 minutes.
Get that clock, and a little bit before 5:30, we have to clean.
Okay. I think it's okay.
No pressure, but just.
No, sure. Okay, thank you. I will talk about MOXO DCPT, that is another computerized platform. And this is available not only in Italy, but also in a lot of countries. I don't know the list, but you can search if you are interested. And MOXO is a computerized test to evaluate the attentional processes, and where CPT stands for continuous performance test, that are a family of tests that require to maintain attention on a continuous stream of stimulus, and then respond to a target stimulus, ignoring the non-target ones. And CPT are considered the gold standard for the evaluation of ADHD, because they are particularly sensitive to attentional difficulties. This stands for distractor system, that is a novelty of the MOXO DCPT. In fact, differently from other continuous performance tests, MOXO includes visual and auditory distractors that emulate everyday life. There are two versions of the test. One is for kids aged 6 to 12, and the other is for teens and adults, the Italian version from 13 to 25. And as you can see, target, non-target, and distractors change according to the age to make the test adequate to the age, to the target age, and also the duration change because it's longer for the adult ones. Okay, the task consists in 8 levels, where that differ for the distractors that appear during the task. So in the screen appear a target or non-target stimulus and a visual or auditory distractors. In the level basic 1 and at the end in the level basic 2, there are no distractors. And these 2 levels are very important because allow to consider the fatigue effect. So allow to see if the performance of the children or of the adult is affected by the time and the duration of the task. Then there are 2 levels for each type of distractors. In the level 1, only 1 distractors appear on the screen, and in level 2, 2 distractors appear. The same for visual and auditory distractors. The level combo are levels where auditory and visual distractors appear simultaneously. So the images and the sound correspond to the images. Each level consists in a presentation period where the target or non-target stimuli appear, and a void period without nothing. And the presence of this void period allows to differentiate the correct responses in rapid or slow, because the test classify responses correct given during the presentation period as rapid, and the responses given in the void period as slow. And this is particularly important for the evaluation of ADHD children, because they show difficulties with temporized tasks. So in classical CPT test, the slow responses are coded as errors. And so we can say that a children is ADHD, even if is the responses was correct but slow. The text provides 4 indices. That is attention, that is the number of correct responses, regardless of the moment in which the responses is given. So regardless of the responses is slow or fast or rapid. Timing, that measure only the rapid correct responses, so only the responses given in the presentation period. And then there are 2 indexes that measure inhibitory control. Impulsivity is the number of response to non-target stimulus. So it measures all the time the children respond to an incorrect stimulus. So it is unable to suppress inappropriate responses. Hyperactivity is the number of multiple responses to a stimulus, because the task asks to the children to press the bar only 1 time. So the strength of this test is, first of all, the stimulus used that don't include the letters, so the test is suitable for children with specific learning disorder, for example, or other disabilities. The distractor system that make the test more ecological, simulating the everyday life context, because one of the bigger problem in measuring attentional processes is that the tasks are often very slow, very rapid, and are administrated in a clinician setting with an higher control of the clinician and the children, and without distracting events, while the test must include the distractors to elicitate attentional difficulties. Then there is 2 versions for a different age that avoid the risk of seeding effect. That is the risk that a task is too easy for a person. And the 4 indices allow us to have a detailed attentional profile, highlighting both strengths and difficulties in the children. In particular, as I said before, differentiate attention and timeliness allow to measure separately rapid and slow responses, and to reduce the risk of false positive. And differentiate impulsivity and hyperactivity also allow to measure separately 2 different aspects of inhibitory control. One is most related to cognitive control, and one most related to motor control. And another strength is the automatic response, automatic report. Even if, as I said, there is need to study to understand, but there is the standardized score of the children, that the risk of presence of ADHD and the graphic of the performance of the children, where we can see in each level the performance of the children, so we can understand if, for example, how distractors modality have an impact on the performance. Maybe I cannot present the study, but was only the results. We compare a group with ADHD and a group of typically developing children using the MOXO, and we saw that the children with ADHD obviously had lower performance in all the 4 indices, but also we see that there was some differences in the impact that distractors have on the performance. In particular, both for visual and auditory distractors, the distractors impact more negatively on ADHD, on attention and impulsivity. Also for auditory distractors, attention and impulsivity are more negatively affected for children with ADHD. And we also found some other difference, but to summarize, we can see that it is important, for example, in the clinical setting or at school, to consider that distractors have an impact that are different for children by children, but also between typically and not typically developing children. For example, some studies say that auditory distractors can help the performance in typically developing children because it in some way an auditory input can help the child to pay attention, but this is not the case for our study for ADHD, and it is important to know this. And in conclusion, to consider the strength and weakness of the computerized tool assessment tool, I can say that as for the TLFA, also in MOXO, we have the huge strength of having 4 different indices in measuring attention. And I think that there are not some similar tests in the Italian context that provide such a lot of indices to understand the functioning of the children. So it's sure an opportunity to use computerized assessment. But I underline another time that we need to integrate this tool with others, because not always there is concordance between results on MOXO, questionnaires, and other kind of tasks. And it's important that the clinician is able to put together all the information and understand the correct conclusion.
And perfect in time. Yeah. You can wait for the coffee now.
Too rapid.
I have 3 things to say, and then there's a room for more. Maybe I think first of all, very interesting. I think it's
so they can see you.
Yeah.
Thank you.
Who can see you? So thank you very much for this insight into your study. I had 3.
More.
Okay.
Yeah. I mean, there's not much to see, but I'm not going to repeat. It was okay. For me, this is a nice example of the benefits, the supplement of digital or tele-assessment. I mean, ADHD is typical measuring attention. It's a lot difficult. I made 18 tests, make standardization. One of them was the TEACH. I don't know whether you know that one, test of everyday attention for children. And then I tried to measure attention deficits for with children. So, but I say that's difficult with giving the child a sign and how fast do you work. This digital version has much more. A PC, a laptop is very good to measure. So that's an advantage, and that's a supplement. That was the first thing. This typical measuring attention, that's nice to do with that kind of tools, but keeping attention to different. The second thing is, I wonder if I understood well, ADHD children are very different. You work with a clinical sample. Do you just put them all together, or there's a lot of difference between clinical samples?
Yeah.
I like just want to say, I for example, work with dyslexia and with dyscalculia children. We never could say you have dyscalculia. And certainly, I know for HDSD, you have HDSD. No, that's the kind of different kind of children. So just the thing is, be aware what kind of ADHD children you have. Have a look, whether they're at that. I just make that, but it's kind of continuum, and it's even on 2 axes. So good to work with a clinical sample, but beware that the most clinical samples are never one group. And then you, and the last thing I missed was a little video. If you go to your next congress, after 10 minutes, you say play, and you show the little animals. That's just a tip for me to make it more attractive. I was curious to see the task, not describe it, but in these days you can say, we're gonna watch a little movie now, ready, and then you see the task.
Yeah, sure.
So,
thank you.
Good to measure attention and response time, for example. It's very accurate. I work with a chronometer, so I make a lot of mistakes. Start, 3, stop, again, go, start. So this is perfect. And clinical children, and show us what you have. That's my third thing. Maybe a reaction to me, or first other questions? Maybe other reactions, questions?
They are on chat.
Other reactions.
Yeah.
Or you wanted to say, I interrupted you. Carlotta, you wanted to say something to the clinical sample?
Yeah, about the clinical sample, we in this study we had children with the ADHD, with the ADHD and the specific learning disorders. So it's a mix, and it's correct to understand.
But also in a group pure, and this is pure autism. We know already autism is ASS is totally, and it's the same for ADHD.
Yeah, absolutely.
Just look very carefully. Also, normal children have a lot of difficulties.
Yeah.
And then your clinical sample, but it's good you do it.
Yeah.
And didn't we want to see the show how it works? Next on your next conference next year, show us. Do you see something on the chat?
Yes, I'm sharing the link of our works for people who can be interested in downloading documents and the manuscript. Carlotta, I don't have the reference for MOXO. Can you add it if you have?
Yeah.
Do you know MOXO in other countries? No? Is it typical Italian? No. I know a lot of neuropsychological platforms.
Is available in the OGREFE website.
It's not provided over there.
Yeah. I don't know if vedere se faceva vedere. Ok. Sì. I was wondering about a video. I don't know if there is.
You can serve it already now.
No.
I was raised with Pac-Man, with that one. Pac-Man. That was the first. That's 1990. Okay. I think we have a little break now, right? 8 minutes before the next session, if you want. Thank you very much.
Thank you so much.
Thank you, everybody.
And also to be online, how many people follow? Can you see? 5, 10, 17, 14.